Losing teeth later in life can feel overwhelming. It affects the way you eat, the way you speak, and sometimes even the way you see yourself in the mirror. For many seniors, the big question becomes simple but important. Should you choose dentures or dental implants? Today, we are going to break this down in a clear and practical way, so you can understand the real differences, the benefits, the drawbacks, and which option might make more sense for you or someone you care about. Let's start with dentures. Dentures are removable artificial teeth designed to replace missing teeth. If all teeth are missing, full dentures are used. If only some teeth are missing, partial dentures can fill in the gaps. They are custom-made to fit your mouth, and they rest directly on your gums. You remove them at night for cleaning, and then put them back in the next day. One of the biggest reasons seniors choose dentures is affordability. Compared to implants, dentures usually cost less upfront. For someone living on retirement savings or a fixed income, that lower initial cost can make a big difference. Another advantage is that dentures do not require surgery. The process is non-invasive, which can be reassuring for seniors who have medical conditions or simply do not want to undergo a surgical procedure. The timeline is also shorter. In many cases, you can receive your dentures within a few weeks. Dentures can also be a practical option for people who have experienced bone loss in the jaw. Since they sit on top of the gums, they do not depend on strong bone support the way implants do. However, dentures are not perfect. Some people find them uncomfortable at first. They may feel bulky or cause sore spots while your mouth adjusts. Because dentures are removable, they can sometimes shift when you are eating or speaking. That movement can be frustrating or even embarrassing in social situations. Chewing power is also reduced compared to natural teeth. Certain foods like steak, nuts, or sticky items may be difficult to handle. Over time, as the jawbone continues to shrink naturally with age, dentures may need to be realigned, adjusted, or even replaced to maintain a good fit. Now let's talk about dental implants. Dental implants are small titanium posts that are surgically placed into the jawbone. Over time, the bone bonds with the implant in a process called osseointegration. Once healing is complete, a crown, bridge, or denture is attached on top. The result is a tooth replacement that is fixed in place and designed to function like a natural tooth. One major advantage of implants is stability. Because they are anchored in the jawbone, they do not slip or move. You can eat, talk, and laugh without worrying about your teeth shifting. Implants also look and feel very natural. Many patients say they forget they even have them. Another important benefit is bone preservation. When you lose a tooth, the jawbone underneath begins to shrink. Implants stimulate the bone, helping to slow or prevent that bone loss. This can help maintain facial structure and reduce the sunken appearance that sometimes develops with long-term tooth loss. Durability is another strong point. With proper care and regular dental visits, implants can last many years and in some cases even a lifetime. But implants do come with some downsides. The biggest one is cost. The upfront investment is significantly higher than dentures. The treatment process also takes longer. After placement, the implant needs several months to heal and bond with the bone before the final restoration is attached. Because implants involve surgery, not everyone is a candidate. Seniors with certain health conditions such as uncontrolled diabetes, severe heart disease, or advanced bone loss may require additional evaluation. In some cases, bone grafting may be needed to build up the jaw before an implant can be placed. So how do you choose between the two? First, consider your overall health. If you are healthy and your dentist confirms you have enough bone support, implants may offer a more stable and long-term solution. Second, think about your budget. Dentures are more affordable at the beginning, but they may require maintenance and replacement over time. Implants cost more upfront, but they are designed for long-term durability. Third, consider your lifestyle and comfort. Are you comfortable removing your teeth at night and cleaning them daily? Or would you prefer something fixed that stays in place all the time and feels closer to natural teeth? There is also a middle option called implant-supported dentures. In this approach, a few implants are placed in the jaw, and the denture snaps securely onto them. This provides much more stability than traditional dentures, while often costing less than a full set of individual implants. For many seniors, This hybrid solution offers a balanced choice. At the end of the day, there is no universal answer. The best decision depends on your health, your expectations, your financial situation, and how you want to live your daily life. Replacing missing teeth is not just about appearance. It is about enjoying meals again, speaking clearly, and feeling confident when you smile at your family and friends. The most important step is having an open conversation with a qualified dentist who can evaluate your specific situation and guide you toward the option that fits you best. Your smile plays a bigger role in your quality of life than you might think. Choosing the right solution can help you regain comfort, confidence, and the freedom to enjoy life fully again.